Hello and welcome. Welcome to the review course for the Massage and Bodywork Licensing Exam, the MBLEx Review Course. I want to say congratulations on being here. I'm really pleased to take this journey with you as we prepare together for you to calmly and confidently pass your MBLEx exam. This first class is Navigating the Body. It's what we call a foundations course, which is designed to give you a review of the foundational learning you got in school, plus a little more. I want to acknowledge that in today's class and throughout the course, we'll be using images from a text called Trail Guide to the Body. It's a brilliant book, and I highly recommend it for purchase. Today's class, again, is called Navigating the Body. This section is designed to orientate you to the body and again to review some of those terms that you learned in school. So let's get started. Our first step will be to review the names and the regions of the body. You'll see both male and female figures in this image. Starting with the male figure, we see the posterior view on the left-hand side of your screen. Some of these terms are going to be familiar, so let's walk through some of them. We see cranial and cervical. Cranial refers to the head, the cranium. Cervical refers to those top 7 vertebrae in the neck. The acromial refers to the shoulder area, while the scapular region refers to the shoulder blade area. We move then into the thoracic area, which is the mid-back. Remember those thoracic vertebrae attached to the ribs. The lumbar region reflects the location of the lumbar vertebrae, about halfway down your screen on the left-hand side. 5 lumbar vertebrae. At the bottom of the spine is the sacrum, and is called the sacral region. The general area is called the pelvic region, and the pelvis takes the shape of a bowl and is sometimes referred to as the pelvic basin. Now moving to the right-hand side of the male figure, you'll see the carpal region, which is the wrist, along with the dorsal region, which is the top of the hand or the top of the foot. Mostly when you hear dorsal, you'll be referring to the top of the foot. And digital refers to the fingers. In anatomy, when we say give me your digits, we're talking about your figures. In the lower area, you'll see the gluteal region. The back of the knee is the popliteal area, directly behind the knee. And finally, the sural region, which refers to the calf area of the leg. Now on to the upper part of the male figure. This is the cephalic region, and that refers to the face. I'm not expecting you to memorize all these words. This course is meant to remind you of the important areas, but also to expose you to some of the anatomical names. For example, sural is not on your MBLEx exam. However, the cephalic vein will be covered a little later on in this course, and it has shown up on some exams. So let's move on over to the female image. There's the facial region, the mandible is the mandibular region, and the supraclavicle region. Now look at that name for a moment, and we're going to break it apart. Supra refers to something above or said before. Now compare that to infra, which means below. So the supraclavicular means above the clavicle. Does that make sense? Moving on to the right-hand side of your screen, down the female arm is the antecubital region, which is the inside part of the elbow. The palmar region, named for the palm. The patellar region, which refers to the kneecap named the patella. The crural region refers to the anterior lower leg, anterior meaning the front and lower leg. And an important region, the dorsal region again of the foot. The dorsal region of the foot we will refer to again later in this course, and it describes a movement of the foot as well, but it is the top of the foot. Just like a dorsal fin is on the top of the dolphin, the dorsal region is on the top of the foot. Moving to the left side of the female figure, you'll see another important region, the plantar region. Plants are in the ground. The plantar muscle touches the ground. This is where the plantar muscle lives and is where plantar fasciitis occurs. You'll see it's the underside of the foot. Moving up the left side of the female figure, in the femoral region, which is named for the long bone of the leg, the femur. The pubic region, named, of course, for the pubic bones. The inguinal region, the site of the inguinal ligament and the femoral lymph nodes. So the inguinal ligaments and the femoral lymph nodes. The abdominal region, of course, named for the abdomen. The cubital region is the pointy end of the elbow, cubital. Moving up the side of the body on your female image, you'll see the brachial region that is literally between the armpit and the elbow. The brachial plexus is a bundle of nerves that originate in the neck region and branch off to form most of the other nerves that control the movements and sensation of the upper limbs, including the shoulder and the hand. Thoracic outlet syndrome is a condition that involves compression of the brachial plexus, of those nerves that run through the top of the arm and all the way down. But moving on, the axillary region is the armpit, and the pectoral region is named for the pectoralis muscle. And that concludes our review of the regions of the body. Moving on to our next images, we're going to go through some descriptive words that describe the directions and positions of the body, as well as some planes of movements. This stuff you probably saw in school, but may not have seen it for quite some time. There are 3 different planes of movement in the upper right-hand image. The sagittal, which is straight down the middle between the eyeballs. One way to remember the sagittal plane is if you get hit with a golf ball between the eyeballs, it'll knock you out. G-I-T, sagittal. Sagittal plane goes straight down the middle of the body. What separates the front of the body from the back of the body is the frontal plane. Easy enough, front to back. The transverse plane cuts the body in half below the belly button. To me, the word transverse looks like the word traverse or travel. To travel means to travel across. I think of a flat horizon, a flat plane walking along a flat path on the horizontal plane. So to traverse, transverse, cuts the body in half. Does that make sense? Hopefully. We're going to see quite a few directions and positions as we review our navigation of the body, so I'd like to give you some ways to remember those words. Let's move along to some descriptive words. We have superior and inferior. Superior is up, inferior is down. The shoulder is superior to the knee. The knee is inferior to the shoulder. We have the descriptive words cranial and caudal. Those refer to above and below. Cranial is above, like pertaining to the head, like the cranium. And the clavicle is circled, as a reminder that it is the anatomical name to the collarbone. And of course, the other circle is the umbilicus, which is a fancy way to say the belly button. So continuing on with our review of the directions and positions of the body, you will see posterior and anterior. Posterior is behind, anterior being in front. The terms medial and lateral are a very common terminology in the massage world. Medial means closer to the body, closer to the midline of the body. Lateral is on the sides, away from or further away from the midline of the body. Likewise, superficial and deep are familiar terms. Superficial is just right on the surface. Deep is further down below the surface. Proximal and distal can sometimes be confusing. Proximal is closer to the midline of the body and also above. Distal is further away from the midline of the body. Proximal is normally the start of a bone, and distal is normally the end. On our images, we'll see the elbow and the wrist with a P and a D. The elbow is proximal to the wrist. Wrist is distal to the elbow. Do you remember that there are two bones in the arm? Do you remember what they are? That's right, the radius and the ulna. The radius and the ulna have a proximal and distal end. In our image of the arm, we see the proximal is higher and closer to the midline of the body. Hold on. How is proximal and closer to the midline? Well, imagine a body standing in anatomical position. If you'd like, stand up, standing in anatomical position, which is arms by your sides, thumbs facing out, feet hip width apart. In that position, Do you see how the elbow is closer to the wrist and to the midline of the body? Likewise, we can use the description proximal and distal for the leg. The proximal and distal ends of the bones of the lower leg. What are the two bones of the lower leg? That's right, the tibia and the fibula. The proximal end of these two bones is the knee. The distal end is the ankle. The ankle is farther away when the body is in anatomical position, and it's also below the knee. We use proximal and distal to describe bones, muscles, direction when a person is in an anatomical position. Finally, the picture in the lower right-hand corner is of the pec major muscle, which actually seems pretty random to me. Not sure why it's there. Continuing along with me is some more movements of the body with flexion and extension of the fingers. In our image, flexion is making a fist. Extension is wide open hand with space between the fingers. Now here's the one that sometimes throws people off, a deduction and abduction of the hips. A deduction of the hips adds to the midline of the body. You can see the two red arrows pointing in. That's adding to the midline of the body. Abduction is the red arrows pointing away from the body. Abduction. Notice the word add, 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 in adduction. Adduction adds to the midline of the body, and then when you abduct a person, you take them away, right? When you abduct them, abduction takes away from the midline of the body. The images on the bottom half of the slide show different forms of rotation. You see medial rotation of the shoulder, and look at the little red arrow in image 1.15. You see medial rotation of the shoulder. Put the arm directly beside the body with the elbow at 90 degrees, making a soft fist. Bring that fist towards the midline of the body. You have medial rotation of the shoulder. Likewise, the opposite movement takes the shoulder into lateral rotation. We can also look at rotation of the spine, and rotation of the spine can either be to the left or to the right. These are all forms of rotation. Yay! More movements of the body. Image 1.19 shows shoulder circumduction. Circumduction can be done at any ball and socket joint. Circumduction involves 4 movements: flexion, extension, abduction, and adduction. Imagine a cone-like movement. A cone-like movement meaning that the limb at the distal end makes a circle, while the proximal end remains fixed. The end closest to the body remains fixed, and the end furthest away makes a circle. Image 1.20 is lateral flexion of the neck. This image is laying down, but basically lateral flexion is bringing the ear to the shoulder. This applies whether we're standing or laying down. We see elevation of the scapula. The scapula is the official name of the shoulder blades, and elevation, just like an elevator, brings it up. Depression, just like the feeling, the movement moves things down. In this example is depression of the mandible. And 2 of my favorites, supination and pronation. You may remember these from school. In that supination is your hands in a position where they can hold a bowl of soup. Supination is of the forearm in this image is turning the doorknob to the right. Pronation of the forearm is the doorknob to the left, or dumping out the bowl of soup. Our little diagram here at the very bottom of the slide talks about another anatomical turn called the spine of the scapula and the infraspinous fossa. It's good to know the anatomy of the scapula or of the shoulder blade. That's what you are looking at in this image is the shoulder blade. Now, 2 parts of the shoulder blade are going to be significant. The spine and that infraspinous fossa. Literally translated, infraspinous is a term that means infra or inferior to the spinous, spine. Fossa effectively translates to mean a shallow depression. So the infraspinous fossa is a little shallow depression right under the spine of the scapula. It's significant it's because where one of our rotator cuffs lives. And that's also a place where our clients often have a lot of tension. The infraspinatus actually lives in that infraspinous fossa. There's even more movements to the body. By the way, we are going to have a quiz on these terms after the lecture. So these are going to be terms that you'll see again on that quiz, and you'll certainly see a lot of these on the MBLEx exam. So on to image 1.25. Do you know what that movement is called? It's turning the foot inward. Turn in your own foot right now. Yep, turn it in. Yep, it's inversion. The next image, 1.26, is eversion. Eversion is a difficult movement for us to perform on our own sometimes, lifting the outside of the foot. The next image, 1.27, is plantar flexion of the foot, pushing down the gas pedal, plantar flexing, whereas image 1.28 is dorsiflexion of the foot. Do you remember when we mentioned the dorsal fin of a dolphin? We're lifting off the gas pedal, lifting up, dorsiflexion of the foot. What you see in image in the upper corner of the right-hand side are images that reflect how you position your client on the table. Quick review. Supine is face up, prone is face down. Then, of course, there's side lying position. For side lying, there's normally a pillow under the head and between the knees. Finally, in the lower left-hand corner of your slide, protraction of the jaw, sticking that chin out, that mandible sticks out with protraction. Then to bring it back is retraction of the jaw. Figure 1.31, deviation of the jaw, moving it side to side. With tight muscles on one side of the jaw, the mandible may appear to be slightly to the left or slightly to the right. Sometimes we see this deviation of the jaw looking a little slanted. And then finally, opposition is a term we use when referring to our fingers. So guys and gals, are you getting tired of movements of the body? Yeah, this is our last slide on movements. Simple flexion. Flexion happens at the trunk of the body, the trunk moving forward, very much like a sit-up exercise. Extension is when we go from forward bend to standing. So if we were in a forward bend position and we stood up and extended the spine, we expand our spine or we extend our neck. You may recognize rotation of the spine. We've already talked about lateral flexion. Here's another example. Lateral flexion is simply an anatomical term for the movement of bending sideways, alternatively known as a side bend or side bending. Just below that image, you can see that lateral flexion can also describe a movement of the neck. In the 4 images below, we are focusing on the cervical spine. How many cervical vertebrae are there? That's right, there's 7. So the cervical spine can go into flexion by bringing the chin towards the chest, and it can go into extension by bringing the chin up by looking up. So this is forward flexion, backward extension. Not to be confused with that lateral flexion. Rotation of the neck is simply looking to the left and looking to the right, and of course we've already demonstrated the neck can go into lateral flexion by bringing the ear towards the shoulder. In a future class, we'll review the bones of the body and talk about our bony landmarks. However, I wanted to make a reference to cervical vertebrae number 1 and cervical vertebrae number 2. They're very instrumental in moving the neck. C1 is also referred to as the atlas bone. The atlas is a reference to Greek mythology, where the Atlas carried the weight of the world on his shoulder. C1 is the atlas, and that articulates, meaning makes a joint, with the ridge of the cranium. Do you remember what that is called, that cranium ridge? The area of the cranium where it meets the start of the cervical vertebrae? Yes, it's called the occipital ridge. The occipital ridge is right where we do that hold at the beginning or end of our massage sessions. I just wanted to point out those anatomical features and know that we'll have to know later on that the atlanto-occipital joint, so the atlas and occipital joint, which articulates between C1 and the occiput. Well, let's move on. And now we see the ribs and the thorax. The thorax refers to the rib cage, the cavity that is enclosed by the ribs, the breastbone, the vertebrae, and all that contains all the organs of circulation and respiration. You'll see there are 2 movements of the rib cage, elevation and expansion, that is during inhalation, When taking a breath, the rib cage expands and elevates. Ideally, the breath expands the rib cage out to the sides and also expands the rib cage front to back. During exhalation, the ribs go down and come in. The rib cage contracts. The movements of the rib and the thorax are elevation and expansion, as well as depression and contraction. In your image, it says collapsing back to the starting location. Do you remember the muscles that are located in between the ribs? Those are called intercostal muscles. Ribs are also known as costals, so in between, costals are the muscles in between the ribs. This is good stuff, right? Moving on to our next slide, we see an image of the movements of the scapula. It's actually not only movements of the scapula, but something called the scapulothoracic joint. That is not actually a joint, it's the scapula gliding against the thoracic region of the spine. As you can see here, lifting up the scapula creates elevation. In the next image of the rock climber, you can see adduction. So in addition to the midline of the body, the second image here of the rock climber has a little red arrow pointing towards the spine, so that is adding to the midline. It can also be called retraction of the scapula. The boxer with the punching bag, that's abduction of the scapula. AB or protraction of the scapula. Now, do you remember which muscle is also commonly called the boxer's muscle? This was kind of a weird one. It's the serratus anterior muscle. It's called the boxer muscle because it abducts and depresses the scapula, making the punching motion possible at the shoulder girdle. So in the far bottom left-hand side of your screen, you'll see the scapula is being pushed down. That's depression of the scapulas. Next to that image, an upward rotation of the left scapula, a lifting of the shoulder. Try it yourself. Scrunch up your shoulder. Lift it upward. When we have upward rotation of the scapula, you'll see the medial anterior corner goes down, but the actual base angle of the scapula goes up. Look at the little red arrows, the direction. Just the opposite with the downward rotation of the scapula on the right side of the figure. The bottom corner of the scapula moves towards the spine, while the superior medial corner moves away from the spine. Moving along. Feel free to pause this webinar, by the way, or rewind it if any of these movements seem confusing. We are moving right along. So 2 movements of the shoulder joint. By the way, the shoulder joint is also known as the glenohumeral joint. Why? Why would it be called the glenohumeral joint? The glenoid fossa, remember fossa effectively translates to mean a shallow depression. The glenoid fossa is technically part of the shoulder blade, but that creates the shoulder joint, the gleno, and then the humerus. The other half of the name comes from the humerus. That would be the long bone of the upper arm. So there you have it, the glenohumeral joint. We have examples here of flexion of the shoulder girdle, handing off the baton in a relay race. Likewise, extension, reaching back to grab the baton, is extension at the shoulder joint. We have examples of abduction and adduction. You're starting to get this now, right? Look at the red arrows. From the positions of arms up, bring those arms closer to the midline of the body. Since we are moving toward the midline of the body, is that AB or adduction? If we're moving towards, we're adding to the midline of the body. Correct, adduction. By comparison, with the arms starting at the side of the body, bringing those arms up and out, and maybe even overhead, that is abduction of the shoulder joint. That's abduction of the shoulder joint. You will get questions like this on the MBLEx exam. When you do, feel free to put your body in anatomical position and walk yourself through the movements. Ask, what adds to the midline of the body? If it adds, it's adduction, adduction. So next on our slide, you'll see here some examples of medial rotation, which we've seen already, and lateral rotation. This can also be called internal and external rotation of the shoulder joint. And in the lower left corner of this slide, we switch to thinking about the horizontal plane. We have abduction and adduction in the horizontal plane. If the arm is straight out beside you, parallel to the ground, palm facing the front, bring your arm straight forward, keeping it on the same plane about chest high. This adds to the midline of the body on the horizontal plane, so it's adduction. Likewise, moving the arm back from the front to the original position is horizontal abduction. Abduction. In the following images, you'll see the elbow and in the forearm. The elbow could also be called the humeral ulnar joint or the humeral radial joints. Why? Yes, the articulation between two bones makes a joint. When two bones are the humerus and the ulnar, that makes it the humeral ulnar joint. And then what would the humeroradial joint be? Yes, that's the articulation between the humerus and the radius. You see in new pictures a flexion of the elbow, lifting the weight lifting a dumbbell, and extension of the elbow, extending the arm straight from the 90-degree position. Repetition helps us learn, so we again see supination and pronation. Turning the doorknob to the right, supination. Turning the doorknob to the left, pronation. How can you tell it's supination? Because when the movement is made, at the end of the movement, you could hold a bowl of soup in your hand. That makes it supination. This course is designed to refamiliarize you with the names of bones, the joints, and common movements so that when we see them on the exam, we truly understand the question being asked. In this slide, we see the wrist or the radiocarpal joint. Why would it be called the radiocarpal joint? The radius and the carpal joint bones articulate. Remember the pathology carpal tunnel syndrome? Carpals are the 8 bones of the wrist. Our images show flexion and extension of the wrist. Make a fist and curl it up. This may look familiar as we've seen it in the movies when some prepare for an arm wrestling competition by flexing their wrist. And then extension. Extension feels really good to many massage therapists. Extend your wrist with open fingers. Now use the other hand to get a deeper stretch, a deeper extension of the wrists. None like our image, open those fingers and push back. We will be very clear about abduction and adduction of the hand. From anatomical position, so again, standing with the palms facing out, the thumbs are pointed out. Bring the pinky finger down is adduction or ulnar deviation. Bringing the thumb up is abduction, also called radial deviation. Adduction, bringing that pinky finger down, adds to the midline of the body. Bringing the thumbs up takes away from the midline to the body. The reason that ulnar and radial deviation are significant is because if we're to move our hand into that position while we're doing body work, it can put undue pressure on the carpal bones and therefore give us radiating pain. This is a good time to mention that proper alignment of the hand when doing a gliding stroke would be to maintain the wrist and hand alignment. So alignment at the radiocarpal joint. So far, so good? You hanging in there? All right, we're going to look at movements of the mandible and the pelvis. We hear sometimes about the pain of TMJ. The temporomandibular joints are an anatomical location. TMJ syndrome, temporomandibular joint syndrome, is when there is pain in the joint. Researchers generally agree that TMJ falls into 3 categories: pain in the muscles that control the jaw function, a physical injury to the jaw, such as a dislocated jaw, or simply arthritis in the joint. That's one of the 3 reasons, the 3 main reasons that people have pain in their TMJ. But back to our movements. The mandible can elevate or depress. The mandible can protract, go forward, project forward, or it can retract, go backward. The mandible can literally laterally deviate, move side to side as well. This is a wonderful image of the pelvis, and it's showing you anterior and posterior tilt. With an anterior tilt, it's easiest to think about the pelvis as a basin or as a pelvis as a bowl. If that bowl tilts forward, it spills forward. That's an anterior tilt. Some confusion comes around the term downward rotation because an anterior tilt is also said to have a downward rotation of the pelvis. But on the front of the pelvis is a bony landmark called the ASIS, the anterior superior iliac spine. The top red arrow is parallel to the ASIS. And if we look at the pelvis, it moves down as the pelvis spills forward. So imagine the lip of a bowl. As the liquid pours out the front, the lip of the bowl tilts down and the silk spills over. Does that make sense? Oh, one other thing, as you can see in this image, a bit of the back of the butt sticking out, which is a classic sign of anterior tilted pelvis. We'll learn more about the muscles that are affected with this anterior pelvis. However, it's good to understand the image so that you can start to translate that to the muscles, but that'll come a little later. In the image of the posteriorly tilted pelvis, it's the exact opposite. That bowl tilts backwards, and there's an upward rotation of the pelvis. And using our analogy of the bowl of soup, that bowl spills backward. The sacrum tucks under, and the posture becomes a very flat lower back, a very flat bottom. Finally, there's the lateral tilt or the one-sided elevation that's also demonstrated shortened muscles on one side that creates the lateral tilt or a one-sided elevation. Any guesses to the muscle that was most likely involved in one-sided elevation or a lateral tilt to the pelvis? Oh, yes, the initials are the QL. Yes, the quadratus lumborum. Good job. As I mentioned before, repetition helps with learning. And so here we are at the hip joint, also known as the coxal joint. This is the coxal joint, not the coccyx. So with the hip, or the coxal joint, flexion is bringing the thigh forward. Extension, bringing the thigh backward. Abduction of the coxal joint, or of the hip, look to the red arrows, moving legs away from the midline of the body. When doing a jumping jack, that's the jumping jack as it jumps out. When the jumping jack jumps in, that's adduction, and therefore must be adding to the midline of the body. With the hip, we also have medial and lateral rotation. You're familiar now with that medial is towards the middle or towards the midline of the body. Lateral is the outside, so moving that hip joint into medial rotation would be accomplished by turning that ankle out. You can see in the image the red arrow indicating that the knee is turning in, and that would in turn be medial rotation of the hip. Likewise, in the opposite movement is the lateral rotation of the hip, and that's turning outward by bringing that ankle in. The knee goes out, that lateral rotation of the hip. When you do that in your own body, if you could stand up and do both medial and lateral rotation, what movement's more difficult on your body? For me, it was medial rotation of the hip. It was a lot stiffer than the lateral rotation. All right, we're almost done with movements. Our last slide looks at the ankle, feet, and toes. We're going to familiarize ourselves with the anatomical names of the ankle, toes, and foot. Tarsals, metatarsals, and phalanges are all bones of the foot. Again, we're just reminding ourselves we don't need to know all those words that are listed, but just to understand that tarsals, metatarsals, and phalanges are all bones in the foot. They're located other places too, but we'll get to that in a minute. The ankle, foot, and toe can all dorsiflex. Dorsiflexion of the ankle means that we're taking the foot off the gas pedal. Dorsiflexion of the foot or the ankle pulls the foot up. Plantar flexing contracts the plantar muscle. P for plantar, P for pushing. P for plantar flexion pushes down the gas pedal. Moving on to the inversion and eversion of the foot. Inverting the foot turns it inward. Did you try that last time? Go ahead and invert your foot right now. That's easy, right? Try the opposite movement. Lift the outside of your foot off the ground by rolling your foot inward. That's everting your foot and is normally a little bit more difficult. Similar to the hand, we see examples of flexion and extension of the toes. And that wraps up our movements of the body. I want to briefly review with you the systems, a few systems, not all the systems, just 5 systems of the body. This will sound very familiar as we walk through these systems of the body. This is the skeletal system. There are 206 bones in the human body. However, we only need to know a little over half. I'm not going to name each bone in this slide because we've already talked so much about the bones, but you can see them listed here. And here's a quick fun fact. In one hand, there's 27 bones, 54 in total. And there are 26 bones in each foot, so 52 in total. So in our hands and feet are 106 bones. That's over half the bones in our body located in our hands and feet. Moving along, the skeletal system is here's the posterior view. We have the axial skeleton and the appendicular skeleton. The axial skeleton, if you remember, includes the vertebrae, the spine, the rib cage, the skull. It's basically there to help us stand up straight. The appendicular skeleton is everything else. It includes the shoulder girdle, the pelvic girdle, the bones, the legs, the arms, and its function is basically for movement of the body. The skeletal system also protects our organs. Moving right along, I mentioned earlier we would talk about joints. The types of joints you find in the human body include the ball and socket joint. Can you think of a location in the body where there is a ball and socket joint? Yes, in the shoulder. That's the one that's pictured. You were also correct if you answered that another ball and socket joint is located in the hip. Good job. The ellipsoidal joint, the radiocarpal joint, is also known as the condyloid joint. Ellipsoidal refers to the shape of the joint. Common items with the ellipsoidal shape are a football, a watermelon, even Skittles. An ellipsoidal joint is when two bones come together. One bone is a condyle, that's a bony landmark thing that sticks out, but the condyle fits into the scooped out elliptical shaped cavity. So the cavity is what's shaped like a football. That's how it gets its name. All right, there's a great example of it in the wrist. Hinge joints are very straightforward. Think of a hinge on your door. Hinge joints are the elbow, joints of the fingers are technically hinge joints, the ankle, the knee are both hinge joints. It moves just in one plane. There's only one saddle joint in the body, and it's at the base of the thumb. The movement of the saddle joint resembles that of a horseback rider sitting in a saddle. So a rider on a horse. The saddle joint it makes the thumb more flexible and more complex than the other fingers, but it's also more difficult to treat when injured. Moving along, the gliding joints are found in the appendicular skeleton. Do you remember we talked about the axial and the appendicular skeleton? The appendicular skeleton is partially made up of the extremities. So examples of gliding joints would be between the carpal bones of the wrist, between the carpal and metacarpals of the palm. Gliding joints are found between the tarsal bones of the ankle, and also between the tarsals and metatarsals of the feet. Our final joint today is the pivot joint. And the pivot joints are joints that allow bones to rotate. In a pivot joint, a cylinder-shaped bone rotates inside another bone. Pivot joints allow only rotary movement, and it is best exemplified by the joint between the atlas and the axis, which are the first and second cervical vertebrae, C1 and C2, which allows for the turning of the head from side to side. That's a beautiful example of a pivot joint. Moving along, we get to the muscular system, one of our favorites, right? In the muscular system, there are 3 types of muscles: skeletal muscles, cardiac muscles, and smooth muscles. Skeletal muscles are voluntary. We make them move with our conscious mind. Cardiac and smooth muscles are involuntary, which means they're not controlled by our conscious mind. Examples of smooth muscles? Well, those are found in the walls of many organs, such as the stomach or the intestines. Cardiac muscle, as you may be able to tell by the name, are found in the heart. And both are involuntary. For example, our heart pumps blood without us even thinking about it. So this is just a brief review of the muscular system. You can see the names of lots of muscles there, but we'll get into greater detail on this system during our anatomy and physiology course. But before we move on, here's one more fun fact. It takes 17 muscles to smile and 43 muscles to frown. So give yourself a break, relax a little, start smiling. Here's the posterior view of the body. The job of the muscles is to produce force and create motion. Other movements occur in the internal organs because of smooth muscles. It helps keep our heart pumping and move through food through our digestive system. Do you remember what connects muscles to bones? Tendons connect muscles to bones, right. On our next slide is a snapshot of the cardiovascular system. What we see here specifically are the heart and the pathways of the arteries. The heart is a cardiac muscle that pumps blood. Arteries transport oxygenated blood away from the heart to many different parts of the body. Blood is what transports oxygen. It also transports nutrients and it transports waste. There are two main types of blood cells, red and white. Ask yourself, okay, if the arteries transport oxygenated blood away from the heart and into the rest of the body, what system brings the blood back? That's what's called blue blood. What brings that back toward the heart? Aha! Veins. That's right. Veins carry oxygen-depleted blood back towards the heart. What metabolic waste does oxygen-depleted blood normally have a lot of? If you said carbon dioxide, you're spot on. Veins carry the blood back towards the heart and eventually to the lungs, where it will be exhaled. Two pathologies to be familiar with around veins. One is deep vein thrombosis. That's simply a clot inside a vein. One other pathology of the veins is called varicose veins. Varicose veins are normally found in the legs. Note that those are a local contraindication. You've seen them before. They're the blue-green muscles that kind of stick out of the surface. You do want to note that these are a local contraindication, meaning the person with varicose veins can get massage. However, it's a contraindication to massage directly on the varicose veins. Moving away now from the cardiovascular system, we are on to the nervous system. There's two basic parts of the nervous system, the central nervous system and the peripheral nervous system. The basic function of the nervous system is to send signals from one part of a body to the other part. The central nervous system is the brain, the spinal cord, and actually the retina in the eye as well. The peripheral nervous system consists of nerve pathways in our extremities and our organs, and the peripheral nervous system are made up of sensory neurons, ganglia, and other nerves that all connect back to the central nervous system. In the nervous system, the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. Here's a fun fact. In a healthy nervous system, signals are transmitted at about 100 meters per second. Did you know that tight muscles can slow down nervous system transmissions? It's true. Yet another benefit of massage. The final system that we'll review today is the lymphatic system. The lymph system is a network of organs, lymph nodes, lymph ducts, and lymph vessels that move lymph fluid from the tissue to the bloodstream. The organs that are a part of the lymphatic system include the thymus gland, the spleen, tonsils. The lymphatic system is a major part of the body's immune system. You may be familiar with lymph nodes. They're normally a little less than a half inch in size, but lymph nodes, they filter the lymph fluid and remove foreign material such as bacteria, even cancer cells. Lymph nodes make more white blood cells when bacteria is recognized, which causes the nodes to swell. This is how the body fights infection. Yay! We're wrapping up. In this webinar, Navigating the Body, that is a part of the review course for the Massage and Bodywork Licensing Exam, we have reviewed the regions of the body, orientations and movements of the body, and body systems. We have reviewed terminology that identifies the regions of the body, words that describe the orientation to the body, and we've even brushed up on some movements of the body. We've revisited the name of joints, and we went over 5 of the 12 systems of the body. Do you feel smarter? This course, Navigating the Body, also gives you a solid foundation to build on by learning new terms or simply refreshing your memory from school. Hey, thanks for being with me today. I believe we're both going to enjoy this journey of preparing you to calmly and confidently pass your exam. Thank you again for taking the time and investing in yourself, even if it's just with your time, because the reward for the time you spend here in this course will be a passing grade on the day of your exam and 2 thumbs up from me. So, congratulations, and I'll see you in our next class.